Welcome once again to Breakfast Central. Now, just over 3 years after the COVID-19 pandemic hit the globe, a new report shows how the pandemic deepened existing inequalities in South Africa and overlooked the needs of young people in the country. The report is The Impact of COVID-19 on Education, Food and Play, Leisure, and of course related adaptations for children and young people, looking at these issues in South Africa and the UK.
It was done by a team of researchers from South Africa, the UK, and Brazil who wanted to conduct a study on the impact of COVID-19 on children and young people, particularly those from disadvantaged households. Now, still talking about this, we see that one of the key findings of the report is that young people's voices and needs were not considered in policy decisions, resulting in their long-term losses.
You recall that South Africa was one of the countries hardest hit by COVID-19, and the study also revealed that due to social isolation and economic disruption caused by lockdowns, children and young people's education has been stunted and their access to nutritious food has also been reduced. Now, joining us to discuss this further is Professor Lochner Marias, is the head of University of Free State Center for Development Support. He's one of the lead researchers on the report. Good morning, Professor. Thanks for your time this morning.
Good morning. Thanks for having me.
It's been more than a year since COVID died down. Why did you think that it was important to still do this research? Was there any specific reasons behind it?
Yeah, I think the main reason has been the fact that when COVID broke out, the concerns were about the lives of people, and mainly adult people. So children were less affected by the COVID pandemic in terms of getting sick and dying. So the challenge was to say, okay, are there long-term implications of COVID on children? They were not thought of as at risk during COVID, but in the long term, our study shows severe pressures and risks to children.
All right, let's talk about these findings, Professor. One of the major findings would be that young people's voices and needs were not considered. Would you maybe share with us if there were some other findings that this report presents?
Yeah, I think the report makes findings about the relationship between three things. So one is learning, the other is access to food, and the other is play or leisure. So what we need to understand is how these things are interacted and how COVID affected them. So the first part of the problem is that we lost several days or a large number of days on learning. So typically across the world in a 2-year period, we lost about 740 days of learning. In South Africa, the formal numbers are a little bit less, yet the problem is that often learning was lost because students went to school only every second week. So effectively, if you look at this, we've lost about half the time of learning over a 2-year period, and that's a big problem. Together with that, the issue is that that many schools have been places where children did receive food. So globally, the estimates are that about 39 billion meals have been lost. And in South Africa, this was a big problem in terms of schools being closed, children not getting access to food. Together with that, then is the problem of leisure and play, social distancing, not allowing play at school or even play at home, outside the home. In many cases, you had the South African Defence Force enforcing people to stay at home, not play in the streets, etc. Now, the point is, if you think about all three of these things, they are sort of interlinked. So you've got learning that's affected. If you don't have food, you can't learn. If you can't play, that inhibits learning. If you don't have food, play becomes a problem. And all of this have contributed to what we see as a mental health problem among young people in South Africa, and in fact across the world in the other three case studies. If you just add the last point to this, is that if you add this problem further in terms of young people needing to find jobs, that youth unemployment has also increased in and after COVID in all three of the case studies we've done. but even more so in South Africa.
Well, is it? I mean, can we argue that these things were avoidable? And of course, the lack that we're talking about here, with regard to young children and young people in South Africa, was it avoidable, or did the South African government just, were they, not prepared enough for COVID-19? Is there ways that they could have, handled the pandemic and still been able to put things in place to ensure that these things do not occur with the young ones?
Yeah, I think the message of the research is this, that in all these decisions, the voices of young people were not heard. And I think that's the important thing, that that we need to think about these implications. And I think in many cases, schools could have opened earlier, play could have been allowed much quicker, and of course, food access. Despite schools being closed, food access could have been provided in larger numbers in this process. So the point is, maybe some of these implications are unavoidable. However, I think some of those that I've mentioned could be avoided. And I think the important point here is that in all of this, we've seldom considered the voice of children, considered the long-term implications of the impact on children. And I think in any future pandemic or future similar event, the voices of young people are extremely important, and we need to account the long-term cost of the impact it had on children that will be for generations to come.
All right, let's talk about some of the recommendations that these findings make. Now that we've seen what the challenges are, we've seen, the outcome. What would you say that are some of the recommendations that these researchers have put together to ensure that children's well-being is incorporated into any potential, hopefully not, any potential future pandemic that might occur?
Yeah, I think the first, we've made sort of five main recommendations. The first one is not at risk is a risk. Okay, so the long and the short is children were seen as transmitters, not affected. However, in the long term, they wouldn't get sick immediately, but in the long term, the risks are real. And by focusing on immediate risk and ignoring the long risk, that has put a risk to children. The second thing that I've already alluded to is I think we need to make sure that we hear the voices of young people. So this is important in order to get an understanding that the impact has had different consequences for different people and different groups of people, and this is crucial. The third thing is the emphasis on schools as hubs. Now, the challenge here is that schools have been closed, but schools could have played even a better role as places where food could have been distributed, providing learning facilities, and I think that's an important aspect of going forward. The fourth one is the fact that play is a right. By locking down people in their homes, ignoring play at schools, etc., is a direct infringement on the right of children, and we need to acknowledge that. And lastly, I think the need for a multi-sectoral approach to support, not just a singular item about COVID deaths, that we need to think about long-term implications of things, that we need to think about how to recover in the school system, try to find ways to catch up, which we are slow at. So those are the five main recommendations from the study.
Thank you so much, Professor Lochner, for joining us this morning, and we hope that these recommendations are being implemented. Do have a wonderful day.
Thank you so much. Keep well.